Today we're going to talk about 3 different exercises to improve your knee pain. We're going to talk about how to execute those exercises and why they improve your knee pain. Hi, I'm Alex Zeffer, founder of Resilient Training and Rehab, and I've helped thousands of clinicians and coaches around the world get more consistent results with their clients. Let's get into it. So the first exercise that I really like to use to improve knee pain is leg extension holds, followed by doing 10 to 15 reps of the leg extensions. When I'm doing it, one of the reasons why it's so good at improving the knee pain is that it really gets that inside quad muscle firing. So I talked about in a previous video how the VMO is very important and it relates to the tibia's ability to internally rotate. Now, when most people get knee pain, it's because they can't bend their knee effectively. And if they can't bend their knee, they're not able to distribute forces. So all the force that goes from the foot up just kind of bundles up in the knee. So it can't really absorb those forces. So what this is going to do is going to teach you how to get this VMO to kick on, to get the tibia to internally rotate while loading the knee in a pain-free way. So what we're gonna do is we're gonna do this a little bit differently than normal kind of leg extensions. I'm gonna actually get you to turn your body a little bit towards the right leg in this case. The right leg is gonna be the active leg. So you're gonna turn the body a little bit towards the right. You're gonna grab onto the handle and you're gonna think about pulling the handle up. And when you pull the handle up, you'll feel your sit bone go down into the pad. The reason why that's important is because if I'm doing the leg extension and I'm leaning forward, leaning up, then I'm not gonna get that VMO really working. I'm just gonna dump the pelvis forward. So I really wanna make sure that pelvis stays back and locked and grounded into the pad. So I'm gonna pull up and then I'm going to grab the pad beside it. That way I can really get that rotation towards this leg. That rotation is going to create internal rotation of this femur, which again is really important to get the tibia to internally rotate. So I'm going to pull up, turn over, and then I'm going to extend the leg. I'm not going to lock out the leg. I'm going to stop maybe 5-10 degrees before it locks out, and I'm going to hold for 30 to 45 seconds. And what you should feel is a lot of VMO kicking on. This outside quad isn't going to be contracted as much as that inside quad. And again, by not locking out the knee, I can keep the knee slightly bent, which is going to help with the tibia to internally rotate. So I'm going to hold it for 30 seconds. And then once I'm done those 30 seconds, I like to get the people to rep out 10 to 15 reps. Again, not extending all the way, stopping at about 5-10 degrees, even reducing the range in which they go into. So my quad's cooking right now, and most specifically, it's gonna be cooking that inside quad. Again, that's gonna help support and distribute force more effectively and start to preload the knee so that when we do other exercises, we can start to reinforce these mechanics. Usually I get people to do about 2 to 3 sets of about 30-second hold, followed by the 10 to 15-second reps. And you could do this as part of your main strength movement. You can do this as part of your warm-up. When people start to come out of that knee pain or that really acute phase of the knee discomfort, I like to just add this in as part of their warm-up. Just to get that blood flow into the area to reinforce it. If you don't have this machine at home, what you can do is you can tie a band around the chair or around a post, and then you do these leg extension holds. You're not gonna get the same resistance as potentially a machine, but you're still gonna get that VMO kicking on, which is just going to get the same type of mechanics as you would using additional weight. So the second exercise is gonna be what I like to call a high half kneeling position with a cable chop. So the reason why I do this high half kneeling position is because sometimes people get into half kneeling, which essentially just means that I'm going down on the ground and I'm kneeling down. But what you'll see is people don't have the hip flexion, so they go into this little bit of a hip hike. And so that's not really the position that I want you to be in. I want you to be able to put force into the ground without arching your back or without doing these compensations. So I actually like to get people to start into this high half kneeling position because you can see my leg is more at 45 degrees than it is at 90. And by doing this, as I pull the cable down, that's gonna force pressure down into my foot, or gonna force my foot to push into the ground, thereby teaching the leg how to load again. A lot of times when people get into trouble is they go to too deep of knee flexion too early, and that just causes a little bit of discomfort. Not saying that's a problem. A lot of people could benefit from deeper ranges of knee flexion, but oftentimes I just like to introduce these lesser ranges of knee flexion in more of an isometric position so we can tolerate teaching that knee how to load properly with the right mechanics. So what you're gonna do is you're gonna set up with your, in this case, your right foot in front, left leg down. The left knee is gonna be underneath the left hip. I'm gonna face towards the cable machine and I'm gonna keep the pressure on the inside edge of the foot. Now, when I look straight down, I should be able to see my knee is in line with the second, or in between the second and fourth toe. I'm gonna grab onto the cable, facing it in front of me. And what I'm gonna do is as I breathe out, without straightening my leg, keep my knee bent, pushing the knee over the toes, I'm gonna pull the cable down towards my back leg. When I pull the cable down, I should feel my foot pressing into the ground harder, just to be able to break the inertia and be able to move the cable. So what I'm gonna do is I'm gonna breathe out on the way down. Stay here as I breathe in. When I breathe in, I'm gonna push even harder with this right leg. Breathe out, come back. So I'm gonna breathe out as I move. Breathe out, breathe in, push into the ground, breathe out, come up. Now, one thing to also think about is this back leg. I wanna keep it active. I don't wanna just sink back. I really wanna push it into the pad. So both the right foot and the left knee are pushing into the pad. And so assume that you have right knee discomfort. This is a great way to really load that right leg, not in a vulnerable position. So I would do about 2 sets of about 8 reps. Again, breathing out as I pull down, breathing in this position, breathe out as I come up. So the third exercise, we're gonna do an overcoming isometric, which just means that I'm trying to come up out of a position, but I can't because maybe the resistance is too high or I'm blocking something, so that I'm just getting as much force production as I can, again, without moving through the full range. So what I really like to do early on is these kind of Jefferson positions, where essentially just means that the bar is gonna be underneath my legs, so that when I'm coming up, it's going to be this concentric or this force production or overcoming movement, so that I'm really putting force into the ground. But again, because I'm restricted in how far I can go, it really causes maximal tension in my leg and starts to reinforce the muscles around my knee. But again, keeping the knee slightly bent so we can reinforce the tibia's ability to internally rotate. So what I'm gonna do is I'm going to, in this case, load up a Smith machine. Now you could take a bar, put it underneath pegs so you can't lift it up, but just something so you can't move the bar. So in this case, I'm just gonna load up the Smith machine. What I'm gonna do is I'm gonna stand over top of the bar. So my right leg is forward, left leg is back. And what this is gonna do, again, is because the bar is underneath me, I can't stand up straight with my leg, but I'm gonna maintain that slight knee bend position. So what I'm gonna do is, because this right leg is forward, I am going to supinate, which means I'm gonna turn my palm forward just to turn my body towards this side, pronate the left arm. So when I come up, I'm not just arching my back, but I'm really keeping that load into the glute, into the quad, into the hamstring. So I'm gonna squat down with a slight lean forward. So I'm not vertical, but I'm slightly horizontal. Supinate the right arm, pronate the left. And then what I'm gonna do is I'm not gonna try to lift with my arms. It's just gonna be with my feet. And I'm just pushing into the ground as hard as I can. And I'm gonna hold for 5 seconds, relax. And I'm gonna drop down again, hold for 5 seconds, and relax. Now the back leg, keep weight off of it. Really lean onto that front leg. So I'm going to pull up, relax. And by doing that, again, I'm creating maximal tension around my leg so that I'm able to really just express as much force as possible. So it's important with knee pain that we understand that in order to fully restore some of that tension, some of the pain, that we reinforce the mechanics and we introduce load. There's another aspect to it where we introduce a little bit more plyometrics, a little more jumping activity to really create elasticity within the tendons, again, to be able to support that load and support the constant movement of us walking or jumping or running. So try these exercises. You can try them in a sequence. You can try them on different days. You can try them as part of a warm-up. You can try them as part of your strength programs. But keep in mind that these aren't specific to you. This is mostly for educational purposes, just to be able to understand. But with that being said, if you like this kind of content, don't forget to like and subscribe, and I'll see you next time.